Hello and welcome again to the Clinics Review Articles podcast. I'm John Vasallo, Senior Clinics Editor at Elsevier, and I'm here with my colleague Katarina Heidhausen and Dr. Joel Heidelbaugh, Clinical Professor of Family Medicine and Urology from the University of Michigan Medical School in Ann Arbor, Michigan. Dr. Heidelbaugh is also the Consulting Editor of Elsevier's Primary Care, Clinics and Office Practice, and Editorial Advisor for our Clinics Collections. The Clinics Collections draws from Elsevier's robust Clinics Review Articles database to provide multidisciplinary teams with practical clinical advice and insights that can be implemented in individual specialties and everyday practice. Today, we're discussing with Dr. Heidelbaugh the topic of our latest edition of the Clinics Collections. It's on a very current and pertinent topic, telehealth. Welcome, Dr. Heidelbaugh.
Thank you very much. It's a privilege to be here.
So it's now the middle of March 2021 when we're recording this, and the U.S. is just over a year into the COVID-19 pandemic. But let's start pre-pandemic. So for instance, how often was telehealth used before the pandemic, and what was it used for?
It's hard to believe it's been a year already, but it certainly has. Telehealth was really thrust into the limelight out of necessity because of the pandemic. But I think if you take a look at the manuscripts in this collection, you'll see that most of the publication dates are early to mid 2020, which tells you they were written in 2019. So before the pandemic, we had already started thinking of ways to introduce telehealth into everyday practice. And a lot of the framework for this came out of patient demand and came out of opportunities to provide other angles of healthcare in other venues. And this is across primary care and specialty care.
Were there any limitations when it was first starting?
I think there were a lot of limitations. I think, at best, when we come up with something and create a great framework and have a lot of meetings about starting a new initiative, obviously there's hiccups and you trip and fall a little bit at the beginning. I think what happened with the pandemic is most of us were really thrust into telehealth at the end of March of 2020 out of necessity. And of course, there were challenges in how to deliver it effectively, but also a lot of technology challenges. And I think that was very challenging for the patients, relative system to system on how they could incorporate this, but also how they could access it.
So in March 2020, COVID hits the US and practitioners had to pivot quickly. What were some of the things that you had to do? Were you prepared?
Well, in my own practice, immediately I went from seeing live patients, 100% of what I do, to for the following, I think it was 2.5 weeks, I was at home making phone calls and trying to help patients figure out how to access their patient portal and establish a video connection on a platform that initially didn't have the bandwidth. I remember initially at Michigan, we were advised to try to limit video visits during the busiest times of the day because the bandwidth couldn't support it. Over time, that network has enlarged, and we've been able to meet a greater demand. I was really challenged. I had a hard time learning how important it is to deliver phone triage and deal with a lot of complex issues over the telephone in the absence of getting vital signs and in the absence of performing physical exams. For those patients who could establish video connections, I think it maintains some personal connection, and certainly that's what we strive for in medicine. But in the early phases, and we were limited to telephone interactions, I think it was very challenging and somewhat limited.
So what's been the evolution of telehealth during the COVID crisis?
It's been fast. Systems have been developed to enhance video communication and enhance sharing of information from providers to patients and vice versa. And this has allowed a lot of different avenues for patient contact. I have patients who are admitted to the hospital who now can be admitted to the hospital and now have a device and see a healthcare provider on a video screen. We've had folks who, rather than having to travel a lot of long distance during inclement weather, they can establish video connections and have conversations with providers. I think a lot of this has served our patients well for conversations and communications in mental health arenas. Certainly, most of psychiatry and psychology and cognitive behavioral therapy has been able to thrive through telehealth while we've limited patient-to-patient or patient-to-provider, I should say, interaction. But also across other venues like in the ICU and in maintaining maternity care and post-surgical care. It's allowed providers to still connect with patients and still get the information and the connection that they need.
And what has the overall patient response been to telehealth? Any advantages or drawbacks that they have voiced?
Great question. I think in some areas it's been slow to adapt. Again, I think out of necessity, you're forced to adapt. We've had a lot of engagement with it, and I think that's expanding every month. I really do. It's only been 12 months, but more patients are finding a way to engage through some type of video connection. We still have a lot rely on telephone connection. There are some patients that prefer not to do telehealth and would still rather be seen, I think, seen in a live patient situation, if that permits. I think we've also felt the feeling of isolation of our patients. For example, I'm taking care of a patient in the hospital right now, very poorly controlled diabetic, renal failure, limb amputation. And he's been isolating for the last year, and he's been finding it very difficult to engage and very difficult to establish connections through a telehealth system.
So when most people think of telehealth, they think of doctor and patient. But has there been telehealth between doctor and doctor, or say a three-way discussion of doctor, specialist, and patient?
Absolutely. I think telehealth has probably every possible permutation you can come up with. There has been a lot more doctor-to-doctor communication. There has been probably easier ways to get more healthcare providers in concert with a patient at a given time than ever before. And the reason for that is the excuse before was location and proximity to the patient. We're never all in the same place at the same time. Now you don't have to be. Now you can have a family meeting at the bedside of a patient in the hospital, and you can bring in a variety of different consultants through virtual care.
That's amazing.
So let's turn to the clinic's collection on telehealth. This collection has 24 review articles in multiple specialties that have all used telehealth, such as pediatrics, critical care, and psychiatry. What was your thought process when selecting the articles for this edition?
So I was impressed to see how many manuscripts had been written on telehealth prior to the pandemic. Again, if you take a look at the publication dates of all of these manuscripts, most of them are mid-2020. And if you count backwards in the publication process, that means they were written in 2019. And some of them were written in 2019 as well, which means they were processed even and conceived even earlier than that. I was impressed with the vast distribution of topics relative to telehealth, but also the detail at which the authors had researched these topics and subtopics. So putting it together was actually fun, but a little bit of a challenge, because I wanted to create a volume that was going to start with design and implementation and scalability and sustainability of the programs, to take the readers down the path of thinking about why telehealth is important, but also understanding how and why it was conceived, again, prior to the pandemic and the need for it. It certainly has implications on health and economics. There's ethical and legal considerations, but it's also really a great way to personalize healthcare. And so all of these subtopics I've just listed here, there were great manuscripts on this, and I think that allowed me to put this together in a good framework for an orientation of some of the subtopics that follow. There were a lot of great manuscripts relative to pediatrics and women's health and gynecology, intensive care unit, sleep medicine, neurology, rehabilitation, but also differences relative to caring for patients in the inpatient and outpatient setting. So when I put the collection together, I tried to start with a framework of telemedicine, what it is, how it's evolving, and then dive into some of the subtopics for relevance to individual practices.
Okay, well, let's dive in a little bit. One of the articles is on telehealth and maternity care. So how has telehealth helped the expectant mother?
Telehealth's been crucial during the pandemic. Unfortunately, in the last year, we've gone through periods of isolation and periods where we're told where we can't leave the house, and periods where, in our clinics and in the hospitals where we've really limited contact and limited visits. So to maintain some type of continuity and offer healthcare to our pregnant patients and their families, this has really been crucial, and it's been a novel way to provide that kind of healthcare. I think in some ways, obviously, it's a little bit limited because it doesn't provide the same level of care that we do in person. But some of the examples that we've seen, at least in maternity care, have to do with screening and education, blood pressure monitoring. There's national programs that have provided blood pressure cuffs for pregnant women so they can check their blood pressure at home and monitor that. And there's ways of checking their sugar levels at home. So again, sort of the out of necessity, this has grown as sort of phenomenon, but there's been a lot of real innovative ways to deliver maternity care during the pandemic through telehealth.
So there are also a number of articles in this clinic's collection that are from psychiatric clinics. How can these articles on psychiatric telehealth benefit the primary care physician?
It serves as a great blueprint. Again, during the pandemic, almost all of psychiatry and almost all of mental health services have gone to a virtual format. I think it's been shown that it can not only thrive, but be very innovative. This helps the primary care provider in a lot of ways. There's been a lot of the care that we've provided over the last year that is focused on mental health, a lot of anxiety, a lot of depression, a lot of fear, a lot of grief, a lot of loss of family members and friends and colleagues and coworkers. So there is a substantial amount of healthcare that primary care clinicians have been providing over the last year through telehealth for mental health services. And that'll continue.
So another article is entitled Impact of Telehealth on the Organization of the Health System and Integrated Care. What are some of the key takeaways here that you see?
Again, I think this is a great manuscript, and it serves as a blueprint and framework for a lot of practices and healthcare organizations and academic centers going forward. We went into this again out of necessity, and we have learned so much in the last year. This particular paper foreshadows a lot of benefits and challenges. There's certainly implications relative to IT. There's definitely benefits and challenges relative to reimbursement. Telehealth probably saved most major health organizations last March through July, because when we couldn't see patients live, we had no way to bill for them. And if we're not providing services and billing, a lot of health systems really struggled. And that's not a secret. The advent of telehealth really allowed not only to carry on some level of care that we could provide, but there's a lot of opportunities to bill for services through telehealth. And I think going forward, this will continue to be an integral part of any healthcare system. Healthcare systems now are setting goals going forward for a certain percentage of patient care to be delivered via telehealth as well. And so, again, I think this manuscript serves as a great framework for others to read and for folks to think about how that weaves into their own unique rewards and challenges in their healthcare systems and practices.
So as you look through the table of contents on this issue of telehealth, are there any other specific articles you'd like to discuss or at least point out to our listeners?
Well, I'm always shy about picking certain ones because I don't want to leave out any. A few really jump out at me relative to the importance of maintaining contact with patients. I think we have always viewed our role as clinicians in seeing patients in a live setting, but the manuscripts that focus on type 1 diabetes, again, maternity care, telepsychiatry, really allow clinicians to be able to stay in touch with patients. And I think our patients have really enjoyed this. I think as we champion in this model, the patients have really embraced the fact that clinicians and all levels of healthcare workers have reached out to them during this challenging time to be able to still care for them. And maybe it's not always face-to-face, but maybe it's video to video, maybe it's telephone, but it's often more than they would be getting if they weren't in our office, which often they can't be. I was impressed with the quality improvement manuscript, and I would love to see a lot of these manuscripts evolve, and I know that there will be future research on this and future manuscripts, because again, we're really in the infancy of what this looks like, and this is going to develop rapidly. Surgical telehealth is mind-boggling, and the fact that you can provide some preoperative and postoperative care via telehealth is really a quantum leap forward in what we can do in medicine.
Well, soon, hopefully soon, we'll be out of this pandemic. So post-pandemic, where do you see the future of telehealth?
It's definitely here to stay, and we were going to do it before the pandemic. So it's going to have a role. I think it's going to have a role in every aspect of medical care. I see it having a huge role in primary care because it's also going to improve access to care. It's going to improve access. It's going to improve follow-up. It's going to help us improve quality metrics. It's going to help us improve global outcomes. And there's a lot of smart people out there right now studying a lot of these things. It's going to take years before we have some good data, but telehealth has already been embraced in psychiatry and mental health. The subspecialties have figured out how they can provide additional referral services and even more timely referral services, which I think is important. And many of the procedural-based specialties now, rather than a patient having to come back to an office visit, can do this via telehealth. It's certainly simple to be able to do that. I think the option for in-person or in-person preference, I should say, will always be there and should always be honored. But I see telehealth growing, and I see a lot of opportunities to be creative about it going forward.
Well, that's fantastic. Okay, we're just about out of time, but did you have any final thoughts?
I can just say that relative to this particular clinics collection, this is certainly timely. And I think our readers can learn a lot about each of these individual subtopics through the manuscripts, but also it's going to drive us to be more creative. It's going to drive us to be more creative, more efficient. It's going to push the envelope of the patient care that we deliver. And I trust that manuscripts of this type will continue to evolve very rapidly. And this is the kind of thing that I could imagine 5 years from now, a clinic's collection on telehealth looking somewhat different, with a lot of data and a lot of lessons learned and a lot of new novel ways to improve telehealth care.
Well, thank you so much for your time, and we really appreciate your comments on telehealth.
Thank you. It's been a pleasure.
Thank you for joining us for this edition of the Clinics Review Articles podcast on telehealth with Dr. Joel Heidelbaugh. To purchase this clinics collection on telehealth or other recent editions on addiction medicine, precision medicine, and depression, please visit us.elsevierhealth.com. For more information on the Clinics Review Article program, which spans nearly 60 medical disciplines, visit www.theclinics.com. Be sure to follow us on Twitter at Clinics Reviews and subscribe to the Clinics Review Articles podcast on iTunes and the Google Play Store. Thanks for listening.